This is CGTN, China Global Television Network.
As COVID-19 cases approach the 2 million mark globally, U.S. President Donald Trump is criticized for halting funding to the World Health Organization. Countries in Africa step up efforts to contain the spread of the novel coronavirus. That's a third of the global total. Meanwhile, more than half of all cases are in Europe, with Spain and Italy the hardest hit. Iran, which is the epicenter of the outbreak in the Middle East, has registered more than 74,000 infections. The Chinese mainland has reported 46 new cases on Tuesday, including 10 local transmissions and 36 people arriving from abroad. Well, U.S. President Donald Trump has drawn condemnation from infectious disease experts. This after he announced he was halting funding to the World Health Organization. Germany's foreign minister has criticized the move, saying we need to work together against a virus that knows no borders. Heiko Maas tweeted that one of the best investments is to strengthen the UN, especially the World Health Organization, which he said was already underfunded. He also highlighted the need to develop and distribute tests and vaccines for COVID-19. CGTN's Nathan King reports from the White House.
After pointing the finger at U.S. governors for 24 hours, the U.S. president now pointing the finger once again at
from the WHO was its disastrous decision to oppose travel restrictions from China and other nations.
The U.S. president also says he has the ultimate authority when it comes to deciding when the U.S. economy is reopened. Governors, including those at the epicenter of the outbreak, say they don't want this fight, but they will decide when, how, and by how much their states will resume economic activities.
That statement cannot stand. And it's not only violative of the Constitution, it's violative to the very concept of democracy. I mean, this was the first battle. Do we want a king or do we want a president? And we opted for a president. So that statement cannot stand, period.
The U.S. president wants to reopen the U.S. economy quickly. He's talked about May 1st as a possible date, one that his leading COVID-19 health advisor says is unlikely.
I think if we are assuming that 2 weeks from now, that all the curves are going to be down, I think that's a bit overly optimistic.
The other major problem in getting Americans back to work is the lack of testing in the U.S. Tensions among the White House, the states, and the private sector have slowed a national rollout of COVID-19 tests. In one bit of good news for the U.S. economy, all the major U.S. airlines have signed a deal that will keep most of their employees on the payroll in return for tens of billions of dollars in financial support. That will stop tens of thousands of more American workers being added to the unemployment lines, at least for now. Nathan King, CGTN at the White House.
Now in Africa, over 16,000 cases of COVID-19 have been reported. The number of recoveries has risen to more than 3,000. Ethiopia has announced 3 new cases, bringing its total to 85. South Africa and Egypt have the most number of infections on the continent. Experts have warned that the numbers will keep rising. They've called for more aid to be channeled to countries with weak health systems. A cargo of essential supplies from the UN is due to arrive. The African nation. CGTN's Lindy Mtongana has more.
The fight against the coronavirus requires a joint effort by all sectors of society. This includes the increasing of the resource capacity of the health systems across the board. With that in mind, China has donated a consignment of personal protective equipment to help South Africa's health and other frontline workers curb the spread of the disease. Health workers rely on personal protective equipment to protect themselves and their patients from being infected and infecting others. So this donation is a critical one in the fight against the spread of the coronavirus.
They are important. They are the most important aspect of our fight against the pandemic. Whatever we do as politicians, it won't make any sense and it won't make any difference if our health workers are not healthy. So our preoccupation as the South African government and Gauteng government is to make sure that they get enough and appropriate PPEs so that they can be able to do their work without any fear.
The Bank of China in particular has donated thousands of personal protective equipment units to the Gauteng Health Department to boost the fight against the coronavirus. Gauteng is South Africa's economic hub.
And comrades plus the buzz is the symbol of the special friendly relationship between China and the South African and between the two ruling parties.
South Africa believes that this donation is a measure of the good relations that the two countries have to be there for each other when there's a need.
I think from the People's Republic of China, it's an important thing that we have to get help from them and assistance. And also, it's not only about the mask. We had an initial engagement early in the month of March with the Consular General when we were starting off. I think we are still having few numbers of infected cases in the country and in Gauteng.
China's assistance comes after South Africa approached the Chinese government and asked for help as the pandemic coronavirus continues to take lives across the globe. Lindy Mtongana for CGTN in Johannesburg, South Africa.
Meanwhile, in Ethiopia, the United Nations has opened a new logistics hub inside Addis Ababa's Bole International Airport. The UN World Food Programme set up the facility to scale up procurement and distribution of protective equipment and medical supplies for the COVID-19 response across the continent. A team of 25 WFP aviation and logistics staff are based at the airport, managing the 24-hour operation.
For medical supplies and life-saving devices to get to countries to save life has been very difficult. So you can understand as a WHO how pleased we are, how comforted we are to have a hub here in African soil, in Addis Ababa, that will be able to dispatch life-saving supplies and devices to all African countries. So we cannot be more than happy that we are. In the middle of the sadness we are.
Now, a team of Tunisian scientists has been analyzing the virus that causes COVID-19. They say RNA test samples taken from Tunisian patients have shown similarities to those in the United States.